Well, we have to remember that both synthetic fillers and fat grafting have invaluable roles in the cosmetic marketplace, and they're both very different. They both have commonality in that they add volume to an area, but synthetic fillers most commonly are made out of hyaluronic acid produced by streptococcus bacteria and then chemically cross-linked to try to add additional stability to the product so that it has greater longevity. The synthetic filler has the advantage of being off the shelf, so there's no donor site required. You simply buy the syringe sterilely, and it's applied by an appropriate and well-trained clinician. One of the big advantages is a lot of these products, and the more commonly used ones, are typically appear like a clear gel, so they can be placed in areas with small volumes to correct fine wrinkles and close to the surface or in the skin itself in a more concealed way to cause some very, very valuable changes. They do, however, get broken down over a period of time, and thus their use has to be maintained over time, which is one of their limitations. Another advantage, of course, is that the correction apply or used when a surgeon or a physician is applying or injecting a cosmetic filler is usually corrected on a one-to-one basis, kind of correcting what you see exactly. So it has a high reliability in that respect. And also it's potentially reversible, because should there be extra lumpiness or changes around the site or extra volume that is unwanted, an enzyme called hyaluronidase can be injected into the area to resorb the filler. So it does have a very valuable role. Fat grafting, on the other hand, is the transfer of full fat cells, whole cells. So they are transferred and not injected in a higher layer in the skin. They're injected below the skin typically, or in deeper layers down near the bone to add additional larger volume to a field. One of their great benefits is, of course, their longevity. If the graft is successful and survives, and the new cells go through a process called take, as the term we give it in medicine, when there's a successful graft incorporation, those cells will survive for an indefinite period of time. So their longevity is significant and it can often exceed a decade or more. Some of the limitations of fat grafting is that you require a donor site. You have to have a place to obtain fat cells from, usually the abdomen, the flank, the leg, somewhere in that order. However, I haven't found a patient yet who hasn't found some place that they'd like to get a little fat removed from and are happy to donate it to another area of their body that they feel they need it. But once the cells are transferred, they're usually transferred in a little over a 1-to-1 ratio, slightly higher because there is a little bit of loss of some of the grafted cells. They don't all survive. And in certain cases, one of the limitations is that you may need to go through the process more than once to get the ideal volume that you're looking for. There's increased bruising compared to minor amounts of bruising you see with fillers. Fat grafting, there'll probably be bruising at both the donor site, where the fat has been taken from, and also at the recipient site, and there may be more swelling associated with that process. But the great advantage is the longevity. But again, because fat is used to try to create a more permanent correction of larger volume areas, whereas fillers are used for finer wrinkles and less commonly used, at least the more temporary ones, for creating larger volume corrections, they both have a significant role.